So as the Director of Nursing, I would encourage any nurse to aspire to become a consultant nurse or midwife if they're a registered midwife. Why would that be? Because obviously it's to deliver expert practice. So for many years, nurses to progress had to leave clinical front-facing, patient-facing jobs to achieve more senior posts. And this allows us to develop a career framework, working through from being a registered nurse to being a senior nurse to being a district nurse to being an advanced nurse practitioner into the role of consultant nurse. It allows you to be able to develop your expert practice, work in partnership with a multidisciplinary team, and be able to provide safe and effective family-centred practice with families in the community. Consultant nurses and midwives are very expert, clinically proficient nurses, midwives who have worked for a number of years, managing their own caseload of patients. They're all completed educational attainment to master's level, and they also are non-medical prescribers. So they've completed their V300 non-medical prescribing programme and are willing to prescribe for patients on their caseload. So to develop yourself to be able to consult a nurse, you have to have had very relevant clinical experience. You have to be able to demonstrate high levels of leadership, strategic influencing, expert knowledge on the evidence base, and be happy to commit to the application of that expert knowledge. So you have to have a high level of confidence. I would expect a typical day or week for a consultant nurse or midwife, be able to demonstrate and apply their expert practice, being involved in strategic leadership, influencing the wider agenda, particularly around the nursing and midwifery transformation agenda, being able to link with our university providers and our education providers, ensuring that programmes for developing nurses in specialist practice or advanced nursing practice are of the highest level and reflect currently the evidence base. And I would expect that they would be involved in research and development or service evaluation. So all of those particular domains and areas of practice would help me as the Director of Nursing be able to assess the outcomes and the improvements that we have delivered through these very senior nursing roles. The Nursing and Midwifery Task Report was issued and launched in March 2020, and it clearly stated that it was the roadmap for nurses and midwives. It emphasised that nurses and midwives had a bigger role to play in population health and public health messaging. But it also said that we had a key role in transforming health and social care. And that's why these consultant nurse and midwife roles are not just focused in hospitals, they're focused in the wider programmes of care, such as district nursing, midwifery, public health nursing, and learning disability, mental health. So some of the areas that may not have had the same career framework, as for example the acute sector, this allows us to be able to develop this career framework for nurses and midwives. But it also means that we're able to deliver care in a different way, because where district nursing sisters or charge nurses have very complex cases in their caseload, the district nurse consultant can actually support them to be able to manage a care plan or a plan of care, coordinate care for some of very complex patients in their own home. Some of these patients previously would have been in the hospital setting or in a care home setting, but this allows us to be able to deliver and support the district nursing teams in a different way. District nursing teams have a very key role to play. They are the palliative care key workers, so they manage people at end of life, where conditions can be very complex and time is very precious. And the consultant district nurse is in a very vital position to be able to support those district nursing teams who may be encountering clinical conditions for the first time or complex healthcare scenarios for the first time. And this allows support for the district nurse and allows for the community nursing team to be able to add that additional dimension of care. For the consultant midwife, that post is particularly pivotal in ensuring high quality, high standards of midwifery care. So we have very experienced consultant district nurse and a very experienced consultant midwife who is then able to provide support to the rest of the newly appointed consultant nursing team in the specialties that I've talked about. So for me as a director of nursing, it's around assurance of their activities and making sure that we definitely are adding value and that they are professional role models for the rest of the nurses within the organisation. So nurses start off in a band 5 in a very clinical role, and this is a very important step for nursing to allow them to have something to aspire to. It also brings to life that nursing and midwifery task group report, where it talked about us doing things the right way to add benefit for patients and in partnership with others. And these roles allow us to be able to reach out and to be able to manage patients, as I say, in a different way.